All right, we're going to start up in about 30 seconds. So thanks for joining us. So great. Good afternoon, and thank you for joining us. My name is Dave Wallach, and I'm the Executive Director of Americans for Responsible Growth. We're a national advocacy group that works with state and local financial leaders, treasurers, comptrollers, and auditors who see firsthand how federal policies impact communities. As the GOP-led House of Representatives aims to send their disastrous budget over to the Senate before Memorial Day, state financial leaders from across the country are warning how this catastrophic bill will leave Americans without access to food assistance and health care, worsen the affordability crisis, and threaten the long-term stability of their states. As we begin, I'll note that we'll be recording this call to share it afterwards, and we will have time for Q&A at the end as well. So with that, I'll pass to our first speaker, State Treasurer Mike Frerichs. Treasurer Frerichs.
All right, Dave, thank you very much. My first question is, can you find anything beautiful in Trump's so-called big, beautiful bill? Personally, I would not define starving working families and stripping them of their health care as beautiful. I would describe these actions as quite the opposite. Trump's big, beautiful bill is small and cold-blooded. There is nothing beautiful about how the House passed this bill early this morning. In fact, the Trump's team in the House are aiding and abetting Trump in his merciless campaign to make the poor poorer. Trump is playing kick the can with Americans' health care. Under Trump's big bombshell of a bill, 490,000 Illinoisans will lose health care coverage. That's nearly half a 500,000 people right here in Illinois. Those folks don't just live only in Chicago. They live in all of our 102 counties. That's the equivalent of the combined population of Rockford, Elgin, Springfield, and Peoria. What if every member of those communities lost their health care? When someone loses their health care, it's not just the individual who is impacted. Just like a manufacturing plant shutting down, the loss of health care benefits can also decimate communities, just like job loss does. And what happens when people don't have health care coverage? They forego preventative care. And when the uninsured are sick, they use an emergency room as their primary care physician. And ER waits get longer for people seeking emergency care. Then those bills roll in. And guess what? The people robbed of their health insurance don't get to kick that can like Trump does. They're stuck with that can. It is their cross to bear. They go on a payment plan. They use their credit card. The bank forecloses on their home. They declare bankruptcy. Trump is kicking cans at all 50 states. These healthcare cuts will have devastating consequences for Illinois' most vulnerable. The Center for American Progress estimates the Trump Republican cuts will lead to nearly 900 avoidable deaths in Illinois alone. This is what happens when you take away people's health care. Congressional Budget Office confirmed $535 billion in cuts to Medicare under Trump's big bloated bill. The trickle-down effects of Trump's big bombshell of a bill is ugly, disgusting, and inhumane. Nearly 50 million Americans, that's 1 in 7 U.S. residents, have been covered through the Affordable Care Act marketplace since January of 2014. And think about that for a minute. More than 28 million children and young adults with pre-existing conditions gained protection. Since the passage of the Affordable Care Act under President Obama, we've been making Americans healthy. Trump and RFK and their Republican team in Congress want to vaccinate less, educate less, and help the average American earn less. The narrative has not erased the railroad tycoons in the late 1800s. Trump is trumpeting them. He is emulating them. Trump wants to make the uber rich even richer, and he wants to make Americans sick, poor, and less educated. Trump's mirroring the grift and greed of the Gilded Age when railroad barons built the first transcontinental railroads on the backs of immigrants for a pittance in pay. Trump and his Republican cronies will cut $24.4 billion in health care for Illinois, leaving state taxpayers to fill the void. And government is never supposed to hurt people. The government is supposed to help people. I encourage all Americans to call their congressmen and women. Tell them that health care is not an option and that we want to keep Americans healthy, able-bodied, housed, fed, employed, and insured.
Thank you, Treasurer Frericks. Now I'll move on to New Mexico State Treasurer Laura Montoya. Treasurer Montoya.
Thank you, Dave. Hello, everyone. Good morning. So this conversation especially is important to me as the outcome of this budget will directly impact a lot of New Mexicans. We know that this is going to impact Americans across this country. The bill is written to cut funding to critical programs that our most vulnerable populations rely on for survival, such as Medicaid and SNAP. To put it in perspective, New Mexico is the nation's largest recipient of Medicaid assistance, with nearly 33% of New Mexicans relying on Medicaid or the Children's Health Insurance Program known as CHIP to cover their health care. That's about 768,344 New Mexicans enrolled in these programs as of June 2024. Additionally, almost 80% of all of our babies are born in New Mexico are born into Medicaid. That's almost 100,000 babies. Many in our disability community, including veterans and veterans with disabilities, rely on Medicaid coverage for essential health services. That matters in New Mexico because we're very proud to have a lot of veterans who are per capita one of the highest in the country of having our veterans. On top of that, 25% of New Mexicans receive supplemental nutritional assistance program known as SNAP or food stamps, the highest rate of any state in the nation. That's over 470,000 New Mexicans supported by SNAP each month. 38% of these recipients are children, and 62% of these recipients are working to make a living and provide for their loved ones. But the paycheck they earn still keeps them below the poverty limits to qualify for this service. In perspective, for every $1 of SNAP benefits, that's $1.54 that comes back and generates into our economy. That means food on the table for our families and access to healthcare and a resilient statewide economy. Contrary to what supporters of these cuts claim, cuts to essential programs like Medicaid or SNAP would do more harm than good, not just for the people who rely on them, but to our state and national economy as a whole. These types of small-minded policy cuts cost more at the end of the day. I want to move to clean energy tax incentives that are also part of the proposal to cut. In New Mexico, a lot of people know us as the second largest in oil production, but we have a lot of wind and sun and solar production and a lot of jobs that have been created that have stimulated the economy and protect our environment at the same time. And we all talk about diversification, and that matters too. So clean energy accounted for almost 20% of all new energy jobs in New Mexico in 2023, presenting more than 13,400 jobs across the state. New Mexico is facing increasingly frequent and severe droughts and fires as temperatures rise to record-breaking levels and critical resources like water become scarcer than ever. These environmental impacts are real and are deeply felt in our communities. New Mexico recently suffered two extremely devastating fires, including the Calf Canyon Hermit's Peak fire, which was the most destructive in our state's history. These fires devastated New Mexico, destroying homes, barns, and ranches and farmland, and placed a huge strain on our resources, food production, our land. And keep in mind, this fire was created by a prescribed burn by the federal government. Many people have not been made whole, and this presents an economic catastrophe for the benefit of our jobs and future devastation and the elimination of protecting our earth and our farmers and ranchers. All in all, these careless cuts are being proposed under the guise of eliminating waste, fraud, and abuse, when in reality, it represents one of the most blatant examples of waste, fraud, and abuse in American history. The bill is poised to waste economic potential by snatching resources from Americans. It defrauds Americans by disguising harmful policy as fiscal responsibility. It abuses power and public trust by targeting people who cannot afford to lose their support without going homeless, hungry, sick, or even dying. We can see right through the hollow branding of this legislation as a big, beautiful bill for what it really is. It's a big bullcrap bailout for those who are already filthy rich on the backs of everyday Americans. According to the Center on Budget and Policy Priorities, if this legislation passes, 1 million households who make more than $1 million of income per year will receive greater tax cuts than 127 million households earning under $100,000. This imbalance in this bill is even more profound when you take into consideration the proposed Medicaid and SNAP cuts. And it doesn't even stop there. This bill would drastically cut federal financial aid. One of the most important ways that middle to low income students can afford an education and begin to build generational wealth and hold government accountable by being able to be educated in our government. Cuts to federal financial aid would be detrimental to students and aspiring students who cannot afford the overinflated cost of college. Putting it in perspective, the average cost of tuition in public four-year institutions is 40 times higher than it was in the 1960s. While they hand out tax breaks to the wealthiest Americans, they're closing the doors of opportunity on working families who are trying to make a living, contribute to our society, and secure financial independence so that they do not have to rely on government assistance. So let's just take a look at some data and some recent history. Not all of us have the resources that Trump had. My daddy couldn't afford to have a not so small loan of more than $60.7 million to start and fail as many as 6 businesses with 6 bankruptcies and then never pay the loan back. Most Americans don't have that type of daddy. Americans are asked for a fair shot, not a multi-million-dollar handout. People want opportunities to succeed through hard work, not handouts or bailouts. Ironically, some of our congressional delegation, who are some of the strongest supporters of gatekeeping government assistance, are the same people who had hundreds of thousands or even millions in PPP loans forgiving during the tough times that they had. So let's look at Georgia. Representative Marjorie Taylor Greene. Did you all know she had $184,504 of PP loans forgiven? Let's move to Florida. Representative Matt Gaetz had $476,000 in PP loans forgiven. Or in Kentucky, Representative Guthrie had an astonishing $4.3 million in PP loans forgiven. The cognitive dissonance required to personally benefit from federal loans and then cut it for those who need it most is astounding. Actually, it's disgusting. This is no accident. It is all by design, and they are intentionally using our tax dollars to keep people uneducated, unhealthy, unsafe, and prevent them from receiving basic needs and assistance while they rig the system for their own personal gain. This is not normal. In any health democracy, the government has a duty to protect and uplift all people, not just themselves for those with money. While Trump wants to fly around in a $400 million private jet gifted by foreign nationals and spend tens of millions of dollars just to go golfing, the rest of us are scrambling to figure out how to make ends meet. New Mexico is now ranked #1 in stress in the country, and we're fighting an uphill battle as more terrible economic policy proposals come to light to make that uphill slope even steeper and harder to climb. I'm calling out the GOP members of Congress to take a stand against such blatant corruption and stand up for the people that you swore an oath to uphold, to represent. Our Constitution was not written to establish an oligarchy or a dictatorship. It is a government by the people and for the people. So I would urge Congress, do your job, stand up for the people, and work. Thank you, Dave.
Thank you, Treasurer Montoya. And now we'll move on to Minnesota State Auditor Julie Blaha. Auditor Blaha.
Thank you, Dave. So glad we're talking about this. Again, my name is Julie Blaha. I'm the Minnesota State Auditor. And in Minnesota, the state auditor oversees about $60 billion in government activity, and most of it is at the local level in my work. And to be fair, we're still trying to figure out what happened in the middle of the night. I'm never too excited to read about anything that happened at 3 a.m. But we can already see that the effects of this bill will reach all the way down to the smallest local communities. When you go after things like Medicaid, in Minnesota, Medicaid covers about 1.2 million people. That's roughly 20% of our state's residents. Almost half are children. Even though kids and parents make up a relatively small portion of the spending, the way that works, most of the dollars in Minnesota go to people with disabilities and for those 65 and older. And these are a lot of people in our communities, particularly in our smaller communities. And so what's going to happen is less money comes in to each of our to the state and then to each of our 87 counties. People are going to be affected that didn't even realize they were receiving care through Medicaid because those costs were offsetting some of the other hospital bills that, again, they didn't realize were directly because of this Medicaid support. In addition, the increase of work programs are going to be an issue. These work requirements are problematic because work requirements don't work, frankly. I mean, if you are trying to, if your goal is to free up money for tax breaks for billionaires, while hiding those same decisions in bureaucracy and red tape and stereotypes about the beneficiaries, well, it'll hit that goal. But if the goal is to give people a leg up to get through tough times, the numbers show that work for benefits programs do not work. All they do is they reduce the number of people receiving benefits while not increasing employment or the earnings from that employment. And when this stuff happens, when it starts to go through, when SNAP benefits, which in Minnesota affect almost 500 million people, you get about 8% of our population. The way it trickles down to a local community is when you have your neighbors are struggling, that means your local government is going to struggle. Your schools are going to have more work to do to support students in poverty. Your hospitals are going to pick up more costs because of people who can't pay their health insurance bills. And that will, again, spread out to your benefits. Local communities are going to pick up the slack just like they do in every economic time. And it's one of those things where, yes, at the federal level, you can look at these cuts as numbers on a spreadsheet. But in a township, I mean, this is your neighbor who babysat you when you were a kid, or this is your middle school basketball coach, or your own kid that are going to be affected by these cuts. And so you're going to pick up the slack. And in Minnesota, local government is primarily funded by property taxes. So you're shifting a lot of these costs onto units of government that use more regressive forms of taxes. So if you are being hit by tariffs or you're being hit by job cuts from the federal government, well, your income may fall quick, but your property values might actually even go up sometimes. So what you have is not only are these costs not going to go away, but they're going to be borne by people with lower incomes and in the most regressive forms of taxation that we have. So ultimately, this is going to all come down to Main Street, and like we have over and over again, local governments are going to pick up the pieces, but at a very real and very significant cost to our neighbors.
Great, thank you. So now we're going to move on to a couple questions. So the first question is as a state financial leader, what do you see as the most alarming long-term consequence of this budget for your state's fiscal health? Would anybody like to start?
Well, I'll just say that there are many consequences for the fiscal health of the state. There'll be lots of gaps in our budget that will have to be filled. But quite frankly, what scares me the most is the physical health of our residents. Mm-hmm. This budget doesn't care. It's all about, I should be careful here. If they actually were trying to pass a balanced budget, we're making cuts, that would make sense. But this is about making cuts just out of spite. It's about making cuts to own the libs. At the same time, there's nothing fiscally responsible about this budget. It's going to grow our federal deficit. This is all about rewarding their friends and punishing the poor. That's not what government should do. Quite frankly, this was passed this morning, and I'm worried about the physical health of people in my state, but I'm worried about what I'm going to continue to find in this awful, big, bloated document as we continue to look through it and as it continues to move through the Senate.
I think just to echo the treasurer, I'll tell you, my biggest concern is that the only way that cuts to the poor work is if you are willing to turn people away at the emergency room and tell them to go home to die. The only way they're going to work if you turn away a kid at lunch and say, I'm sorry, you're not eating today. Those are the only ways this works. But here's the thing, we don't do that. We don't do that in America. And especially in your local communities, you're going to get that kid lunch. You're going to provide emergency care for that person. You're going to work to keep that senior in their home in your community. But you're going to have to now dig it out of your budget that was never set up for that kind of work. As a result, it may, even if it gets it done, it's going to get it done less efficiently and at a higher, more regressive cost to the neighbors. So the thing is, again, you have to, the only way this works to save money is if you are cruel. And you know what, Americans, especially in their local communities, are not cruel. So as a result, all this is going to do is shift costs, shift them down onto your property taxes, onto your sales taxes, and onto onto the more to the least wealthy people in our country. It just won't work.
I think for me, it's a breakdown of what our democracy is supposed to be. From an economic standpoint, you're creating a lot of volatility in the market today, but impacts that are going to affect pensioners, that are going to affect long-term financial stability. As far as relationships, this definitely creates a distrust among Americans. It adds more stress, which creates more problems locally, whether it's property crime, whether it's drugs, whether it's suicide. People are going to die because of these cuts. People who can't afford to go 2 hours from a rural area because their clinic got cut down, and so they have to drive 2 hours to get to a hospital. People who are going to have to start doing more emergency care because they can't go and see a doctor. Hospitals will end up having to close down or limit the types of services that they have. There's going to be long-term economic problems that are going to affect us for generations to come. I think for me, I'm really struggling with this bill because I had always learned that I don't care what side of the aisle you were on, you loved your country, you loved your people, you loved your community. It was about service. It was about treating people the way you want to be treated. It was about, helping somebody, giving a helping hand. I mean, when you look at Christian values, none of this is Christian values either. So I'm just blown away that we have people that are so cruel to think that it's okay for some to survive and some not to, just because you're going to try to continue to eliminate waste, fraud, and abuse when the actual abuse long term is what they're doing. Yeah.
Okay. Next question is related to that. Is in your state, what would be the economic ripple effects if food assistance is gutted both for recipients and for local economies?
Well, it is being gutted. I mean, we're looking at not just SNAP benefits, food stamps for most people. We're also looking that you have these tariffs that are happening on the other end. You have people who are not coming to go work on the farms. You have fires who are devastating some farmland. Like holistically, you're already creating something. I mean, we've seen this on TV in Russia and other countries where there's hardly any food in the grocery store area. This is what you're going to end up getting if we continue to go down this path. So we need to be able to provide healthy, sustainable jobs and healthy, sustainable food. How is it that we're okay with sending kids to school hungry or scared because they might not see their parents again? Like overall, the devastation of all of these policies makes no sense to tell me that you love our country and you love our people and you're grateful for the people who have served it and sacrificed for it and worked for it when you make policy decisions like this.
In Minnesota too, when we have, again, about 1 in 13 people in Minnesota use SNAP benefits. That is a significant number. And if you took out those people, not only they're your neighbors who are hungry, but also that affects our agricultural sector, where you have people not consuming food because they can't afford it. That's going to hit, again, it's going to hit our farmers. That's going to hit our grocery store employees. This really always ripples through. It connects to everything. I think one of my biggest concerns is they'll talk about, you see people talking about, say, working programs. Well, 52% of our SNAP recipients are already in working families. So it's not going to change. All it will do is bump some other people off. If you aren't able to work now, chances are it's not because you didn't have a requirement. You were already seeking work. You are already working to do that. You know, if you're going to cut the portion that we pay as a state that we get into Minnesota, I don't, you know, our state's just going to try to find a way to backfill it, and that means we're going to cut something else. And so I don't know whether the cuts come from schools. I don't know whether the cuts come from transportation. We're running out of places to find cuts to make up for what the federal government is shortchanging us.
Yeah, I think you'll see lots of ripple effects out there. So cuts to SNAP will hurt people's ability to be fed. Cuts to things like food banks are going to be harmful as well. There are cuts to programs that allow food banks to buy from local farmers. That will translate to decreased revenue for our farmers already on top of the trade war, which is hurting them. And then there's talk in this bill about requiring the states to pay somewhere from 5 to 25% of these benefits. You know, I don't know if they look at state budgets that they're not flush with cash. This is going to either mean tax increases for people or further cuts to important services states are delivering. There will be ripple effects galore, and I think we're just now seeing the beginning of them.
Okay, the next question is the proposed changes to SNAP include a cost share with states, meaning that states will be required to pay between 5% and 25% of the annual benefit cost based upon their payment error rates. What do you see as the implications of this for your state?
Well, for this year, our budget has already been approved by the legislature and the governor. So all of these shifts and changes are going to require a special session that costs money. And it's going to require having to figure out the liquidity needs from our portfolios to be able to find the money and sustain. It causes a lot of chaos and anxiety of where are we going to have to fill the need. And in the meantime, while we're trying to work through that and understand where those needs are located, people are going to be affected directly.
Minnesota's in that same place right now. Right now, we're already facing a special session for our current budget cycle, a setting session, the concern is that we're going to have to come back again in July or August and figure this out as well. So that also is as a challenge when these things come in so late, and right when we're all trying to set our budgets. And we can't plan ahead. Anytime you can't make long-term plans, you miss opportunities, and it basically costs you money. The further out you can plan, the more you can save, the less you'll waste. And when these things come in, come in the middle of the night, when you've already set or are nearly set on your budget, it just throws everything out of whack. That it's more about that chaos. Not only are we not going to want to shortchange hungry kids, but we're also, this chaos just makes planning so difficult. And as a result, the dollars just don't stretch as further when you can't plan for them properly.
Okay, now we'll take the final question. Are there specific federal programs that, if cut, would create unsustainable financial pressures that your state cannot absorb?
Yeah, I think the cuts to SNAP would be really difficult to absorb, and cuts to healthcare. If we wanted to maintain the same level of healthcare, the state would not be able to absorb those cuts. But that's not the purpose here. The purpose is to cause pain. The pain is part of the program here. They want to make sure that the wealthy get their tax cuts, but that the poor are paying for this. I think you've seen estimates that show something like 10% of you're going to see a 10% increase in cost for poor people, while the uber rich will have a 4% reduction in their tax bill. This is literally robbing the poor to pay the rich. This is the opposite of Robin Hood.
Julie or
You're muted.
I think there's going to be a really tough wake-up call for a lot of people. Again, 1 in 5 Minnesotans are connected to Medicare, to Medicaid, excuse me. And I don't think a lot of people realize how it touches their lives. And I'm afraid it's going to be a really rude wake-up call for a lot of people as they see these pressures coming really to their homes.
Everyone's going to feel it. I mean, in New Mexico, our legislature was proactive in getting a Medicaid trust fund account to help with any of the reversions from this fiscal year going into that trust account to try to help just in case we have a situation. But the reality is that our New Mexicans pay federal taxes just like they pay state taxes, and that money should be used for them. I mean, that's the whole point of paying taxes, is that you're supposed to do it to contribute to everyone within your community. When you have people saying stuff like waste, fraud, and abuse, but at the end of the day, these people make less than 50,000, less than 35,000 for a family of 2 or 3 or even 4, and you're saying that somehow they're wasting money. I mean, there are these programs in effect and have been for a long time because they help people. And some people think it's far off, but the reality is I wouldn't be your state treasurer if I didn't have financial aid. I wouldn't have been able to go to school. And that wasn't because I was lazy, and it wasn't because I just went to school. I worked 3 jobs while I went to school full time, and it still wasn't enough. So then I was on food stamps. So when you tell me like there's waste, fraud, and abuse in the system of that, I would say go to whoever's paying the least amount of taxes or paying less taxes than a person with a family of 3, and go talk to them first about how to eliminate waste, fraud, and abuse, then talking to somebody who's working 3 jobs, going to school full time, and still needing to get food stamps or Section 8 housing. These programs are in effect to help people during their most vulnerable times. You heard me during my talking points. There were congressional people who made hundreds of thousands or millions of dollars during PPP loans when times were tough. Well, guess what? Times are tough for the rest of us. We need help too. And then what happens? Your net IRR of me getting a master's degree and a bachelor's degree and being able to serve my community for 25 years has paid for itself in dividends. So for you to intentionally try to make people that look like me uneducated or not have the same opportunities because we didn't have somebody that we could ask for a pretend loan to go to school, it's careless, it's thoughtless, it's disrespectful, and it's blatantly insulting to try to call that waste, fraud, and abuse when there's so much waste, fraud, and abuse at the national level with lots of dollars instead of going after people who are barely making ends meet.
And if I could say one more thing about this question, which I think is a really good one, the idea that are there specific federal programs? I also worry about a death by 1,000 cuts. The idea that if you say, well, I mean, Medicaid is essential, and they'll say, great, we won't cut that, let's cut SNAP. SNAP's essential too. Great, we won't cut that. We'll cut all, education funding. It's like you still have never funded special ed fully yet at the federal level. And so here's the thing, you're just pushing on a balloon. When you make these cuts, it just shifts the cost somewhere else. These are things that are important, and these are things that as Americans we're going to do for each other. And I find it very disingenuous when the federal government wants to, or there are people in the federal government who want to take credit for cutting things when all they've done is pass the buck onto their local communities, and we have to scramble to cover for their cruelty.
Great. Thank you, Auditor Blaha and Treasurer Ferrix and Treasurer Montoya. For those of you who are attending this press event, we'll share the recording with you shortly, and thank you for being with us. Have a good day.